Okay, so what we're going to talk about here is kind of a progression of how to get into this region up in here. So this may be different depending on the circumstances. If you have just a typical shoulder or anatomically accurate shoulder, so you haven't had any major surgery like reconstructive surgery, like a shoulder replacement or reverse shoulder replacement, that might change some of the dynamics of what's going on up in here. You also have to be mindful of like rotator cuff involvement and be careful with that. What we want to try to do is use your body as well as possible. So the first thing is I'm using this wall behind me. I'm going to back up with my rear end with my hips. I can bend my knees a little bit here because I actually want to think about the functional aspect of this. I'm also using my like a cane here, an adjustable cane or a dowel or broom handle. And I don't want to be real forceful with this, especially if I'm in that category of post-operative or major issues with that shoulder or pain. Definitely want to try to steer clear of pain here, but I want to use my body with good mechanics, good function. I'm going to reach back with my hips. I'm going to press my hips and keep that tension back there. Don't lose that tension. You definitely don't want your hips coming off the wall, or you're going to lose that stability and the grounding from your feet and your legs. So I'm going to press back there. I'm going to bow forward with my chest. I want to keep my chest forward, my shoulder blades back. So my hip blades, my two halves of the pelvis are back, my two shoulder blades are back, chest is up and forward. It's going to play even a greater role as we come up. I want to make sure I'm lifting the chest as I pull the shoulder blades back, press those hips, maybe in those lower ribs, tuck those and press those back. And so again, my right side is my target. I'm going to lift, kind of rotate as I drive through that chest and try to bring that up and out. Now, if I have my elbow bent, that's going to be more of like rotator cuff or rotation of the shoulder. If my arm is straighter, I might be able to kind of bring that up and back here as more of a long lever axis point with not involving rotation. So that might be a little bit more feasible, especially starting off, even though it's more leverage. That's why I have the stick here. So I can kind of help guide that up. And then especially coming back down, you have to remember that it's harder for muscles to control things when they lengthen than when they're shortening. So even though it's harder leverage-wise to pull up, coordination-wise, it's easier for the muscles to shorten into that versus to lengthen into this. So especially if you're prone to having pain or if you have a lot of weakness or poor motor control, make sure you got that stick there just so that the arm doesn't end up getting overloaded or stressed and kind of come down and across. So again, I'm kind of going down and bending my knees a little, pushing back in the wall, coming up and across, lifting my chest, rotating through my torso, using my core, using my scapular muscles to pull that shoulder blade back and guiding that up. I'm not forcing anything here. I'm trying to make sure all those pieces are in order. I'm not forcing the shoulder. I'm not doing anything that's painful. And now I can try with my elbow bent, which again is going to be more rotation. Now, if I feel like there's just some parking brakes engaged and I can't get it out, I may want to go through, keep a little pressure here, right? And especially if you're in that post-operative category and you have trouble with your deltoids, squeezing through the palm is known to encourage some of those muscles to fire to stabilize better. So it might actually help you to better control if you're actually squeezing. Not too intensely, you don't want to like tense up your whole body, but just squeezing that palm a little bit. And so if I'm pushing into that stick just a little bit, that little bit of downward pressure, that's going to engage those muscles that might be tight, and now I can maybe train them to release a little bit so I can work that eccentric maybe coming out here a little bit. I'm allowing my trunk to move, and potentially I don't want to wrench through my shoulder, especially into these rotations. I want to make sure that there's give in my body and that I'm not overtaxing, overstressing the shoulder, and I can progressively bring it up and over and across like this. Very gentle. I'm keeping that little bit of tension to get those muscles to disengage. And then if I'm working on strengthening the muscles on the other side, I may not be pushing down here. I may just be using my bottom hand here to give it some support as I think about lifting it up. I'm almost just kind of hovering it there I'm kind of guiding it up with my left hand here to bring it up or to bring it up. But I'm still moving, guiding with my body. I'm shifting my weight to my right leg here and I'm leveraging up and pushing off of my left to help those things along. So nice and easy, don't overstress, overstrain, listen to your body, don't go too quickly.